This is a video for educational purposes. It's the first video. I would make another one just on the back of this regarding an incident I had with YouTube recently. But what this is from YouTube's Help Centre. It's COVID-19 medical misinformation policy. Safety of our creators, viewers and partners is our highest priority. We look for each of you to help us protect this unique and vibrant community. It's important you understand our community guidelines and the role they play in our shared responsibility to keep YouTube safe. Take the time to carefully read the policy below. You can also check out this page for a full list of our guidelines. YouTube doesn't allow content about COVID-19 that poses a serious risk of egregious harm. YouTube doesn't allow content that spreads medical misinformation that contradicts local health authorities or the World Health Organization, WHO, medical information about COVID-19. This is limited to content that contradicts WHO or local authority guidance on treatment, prevention, diagnosis, transmission, social distancing and self-isolation guidelines, and the existence of COVID-19. Note, YouTube policies on COVID-19 are subject to change in response to changes on global or local health authorities' guidance on the virus. This policy was published on May 20th, 2020. So their guidance changes in line with how these unspecified local health authorities' guidance changes on the topic. What this policy means for you: if you're posting content, don't post content on YouTube if it includes any of the following: treatment information, content that encourages the use of home remedies, prayer or rituals in place of medical treatment, such as consulting a doctor or going to the hospital. I don't think treatment's consulting a doctor or going to the hospital, but hey-ho. Content that claims that there's a guaranteed cure for COVID-19. Content that recommends use of ivermectin or hydroxychloroquine for the treatment of COVID-19. Claims that ivermectin or hydroxychloroquine are effective treatments for COVID-19. Other content that discourages people from consulting a medical professional or seeking medical advice. Prevention information, content that promotes prevention methods that contradict local health authorities or WHO. That's these unspecified local health authorities again. Claims that there is a guaranteed prevention method for COVID-19. Claims that any medication or vaccination is a guaranteed prevention method of COVID-19. Content that recommends use of ivermectin or hydroxychloroquine for the prevention of COVID-19. Claims that wearing a mask is dangerous or causes negative physical health effects. Claims that masks do not play a role in preventing the contraction or transmission of COVID-19. Claims about COVID-19 vaccination that contradict expert consensus from local health authorities or WHO. Claims that an approved COVID-19 vaccine will cause death, infertility, miscarriage, autism, or contraction of other infectious diseases. Claims that an approved COVID-19 vaccine will contain substances that are not on the vaccine ingredient list, such as biological matter from fetuses, e.g. fetal tissue, fetal cell lines, or animal products. Claims that an approved COVID-19 vaccine will contain substances or devices meant to track or identify those who've received it. Claims that an approved COVID-19 vaccine will alter a person's genetic makeup. Claims that COVID-19 vaccines do not reduce risk of contracting COVID-19. Claims that any vaccine causes contraction of COVID-19. Claims that a specific population will be required by any entity except for a government to take part in vaccine trials or receive the vaccine first. Content that promotes the use of unapproved or homemade COVID-19 vaccines. Instructions to counterfeit vaccine certificates or others, or offers for sale of such other documents. Diagnostic information, content that promotes diagnostic methods that contradict local health authorities or WHO. Transmission information, content that promotes transmission information that contradicts local authorities or WHO, local health authorities or WHO. Content that claims that COVID-19 is not caused by a viral infection. Content that claims COVID-19 is not contagious. Content that claims that COVID-19 cannot be spread in certain climates or geographies. Content that claims that any group or individual has immunity to the virus or cannot transmit the virus. Social distancing and self-isolation and misinformation. content that disputes the efficacy of local health authorities or WHO's guidance on physical distance or self-isolation measures to reduce transmission of COVID-19. Content that denies the existence of COVID-19, denial that COVID-19 exists, claims that people have not died or gotten sick from COVID-19, claims that the virus no longer exists or that the pandemic is over, claims that the symptoms, death rates, or contagiousness of COVID-19 are less severe or equally as severe as the common cold or seasonal flu, claims that the symptoms of COVID-19 are never severe. Examples. Here are some examples of content not allowed on YouTube. Denial of that COVID-19 exists, claims that people have not died from COVID-19, claims that any vaccine is a guaranteed prevention method for COVID-19, claims that a specific treatment or medicine is a guaranteed cure for COVID-19, claims that hydroxychloroquine saves people from COVID-19, promotion of MMS, miracle mineral solution, for the treatment of COVID-19, claims that certain people have immunity to COVID-19 due to their race or nationality, encouraging taking home remedies instead of getting medical treatment when sick, discouraging people from consulting a medical professional if they're sick, content that claims that holding your breath can be used as a diagnostic test for COVID-19, videos alleging that if you avoid Asian food you won't get the coronavirus, videos alleging that setting off fireworks can clean the air of that virus and will prevent the spread of the virus, claims that COVID-19 is caused by radiation from 5G networks, videos alleging that COVID-19 tests is the cause of the virus, claims that countries with hot climates will not experience the spread of the virus, videos alleging that social distancing and self-isolation are not effective in reducing the spread of the virus, claims that wearing a mask causes oxygen levels to drop to dangerous levels, claims that masks cause lung cancer or brain damage, claims that wearing a mask gives you 19, claims that the COVID-19 vaccine will kill people who receive it, claims that COVID-19 vaccine will be used as a means of population reduction, videos claiming that COVID-19 vaccine will contain fetal tissue, claims that the flu vaccine causes contraction of COVID-19, claims that COVID-19 vaccines are not effective in preventing the spread of COVID-19, claims that COVID-19 vaccine causes contraction of other infectious diseases or makes people more vulnerable to contraction of other infectious diseases, claims that the COVID-19 vaccine contain a microchip or tracking device, claims that achieving herd immunity through natural infection is safer than vaccinating the population, claims that COVID-19 never causes serious symptoms or hospitalization, claims that the death rate from the seasonal flu is higher than the death rate of COVID-19, claims that people are immune to the virus based on their race, claims that children cannot or do not contract COVID-19, claims that there have not been cases or deaths in countries where cases or deaths have been confirmed by local health authorities, or the WHO. Educational documentary, scientific or artistic content. We may allow content that violates the misinformation policies noticed on this page if that content includes context that gives equal or greater weight to countervailing views from local health authorities or to medical or scientific consensus. We may also make exceptions if the purpose of the content is to condemn or dispute misinformation that violates our policies. This content must appear in the images or audio of the video itself, providing in the title or description is insufficient. What happens What happens if content violates this policy? If your content violates this policy, we'll remove the content and send you an email to let you know. If this is your first time violating our community guidelines, you'll get a warning with no penalty to your channel. If it's not, we'll issue a strike against your channel. If you get 3 strikes, your channel will be terminated. You can learn more about our strike system here. We may terminate your channel or account for repeated violations of the community guidelines or terms of service. We may also terminate your channel or account after a single case of severe abuse, or when the channel is dedicated to a policy violation. You can learn more about channel or account terminations here. That's the end of that part of the educational video. There's a bit. Was this helpful? Well, of course it was helpful. It's so enlightening.